The conference was to have been called Communicating Spiritual Care, Exploration, Expression and Delivery. And maybe we'll do that another time in the future. We had some great speakers lined up, and all those plans, like so many others, were put aside. I thought I'd look in my diary at what I had done rather than come to the conference at that time, due to the fact that I was now available. I didn't pretend to the hospice that I'd gone off to a conference that wasn't happening. So on the Monday, I noted I took the funeral of a patient who I probably had known over the longest period of any patients that I'd ever known. I'd known her as a patient at Addenbrooke's when I'd worked there previously, when I was a chaplain there some 8 or 9 years before. And I then journeyed with her when she'd come under the care of the hospice. She had multiple comorbidities. She was now in her early 40s, yet should anyone see her, they would wonder how someone with the lowest BMI you've ever seen could still be alive. And eventually, obviously, she died. She had faith and she found peace. And she herself had touched the lives of many. But only 10 people were allowed to attend her funeral. On the Tuesday, I saw a patient, maybe 2, on the inpatient unit. But only those who'd specifically asked to see me, as any unnecessary patient contact was not permitted. So in scrubs, and mask, and apron, and gloves, and visor, I attempted to ensure I could come alongside a patient aware of the new physical barriers that were now present. And it was challenging. On Wednesday, the last day of the conference, sorry, I won't go on all week. On Wednesday, I had one of the many fit tests of masks, so I could safely visit COVID patients in intensive or critical care in one of the 2 hospitals at which I do on call. Each hospital had different masks, and as supplies were not as plentiful in the early days, they kept changing suppliers. So every time they changed a supplier, so a new mask and a new fit test. And there was no avoiding the reality, sadly, that my beard had to go to get an airtight fit. I did live in denial for a little while about this, but eventually it had to go. So a literal change in identity occurred, both in the clothes I wore in encountering patients and the way that I looked. In the period of just a few weeks, life had changed, of course, not just in our work environment, but in our home environment too. And it didn't seem to be getting any better anytime soon, and indeed it didn't. We learned how to work Zoom and Teams. We adapted to talking to people in less than ideal circumstances. We were proxies to the dying, where the families were sadly not able to be present, and we were tested. I know that testing was so different for each of us. I know that some hospices suffered great numbers of losses of patients, while some had no COVID in their patient populations at all. Those in palliative care hospitals were in a whole new world, as I remember Tracy so clearly conveying in her video clip last year. I know my chaplaincy colleagues in the acute sector down the road from me faced a more challenging time. But that doesn't change the fact that for each of us, at work and at home, everything we thought was permanent became transient. And what's more, uncertain. We, like our patients, were dealing with massive change and uncertainty. I'm not sure if and how that confidence in what we know or knew to be solid ground before COVID will return. Will we remain wary of another such pandemic? Or will we gain the confidence we need to live without such fear? What about our work? What about the different ways of working that we had to deal with? The new ways of working, for some suboptimal, but also the circumstances that produced the profound moments. I hope you had some of those, where a family were comforted in the knowledge that you were able to be with their loved one when in some circumstances, rightly or wrongly, they couldn't. or when you saw fear turn to peace in the eyes of the patient? Or what about when you found yourself not doing your job, not able to have the time to do the things the way you wanted? Or in some cases, just being forbidden to do some things. Maybe there were some decisions taken for the benefit of the greater good and the benefit of a patient that may not have been completely sanctioned by those in authority over you. If they had known, of course. And what about the many things that only you know you did? Only you and your God, if you believe in one. Well, if you do, he knows. And what about the exhaustion? What about a moment to regroup, a moment to reflect, a moment to understand? Well, I hope this time together over the next few days will help with some of that restoration. Things are returning to normal, but of course the world stage is changing. Russia's aggression again brings with it uncertainty. Of course, there are other conflicts around the world, but like caring for a patient who is a similar age and stage in life to ourselves, I think as we look at Ukraine, we see our towns and our cities and realise how unthinkable it is that someone should be an aggressor towards us and destroy our homes and kill those whom we love. We identify with the Ukrainian people and our hearts go out to them again as the image we had of the world order is challenged. We have all this going on in the background as we seek to care pastorally for our patients and their families, for whom too this is also in the background. Are we the same people who attended or might have attended the conference in 2019? I suspect not. Well, for a start, we're 3 years older. But what else has happened to us? And our roles? How many were chaplains then and are not now? In some of the research done over this last 2 years, which Karen mentioned last year, it became clear that there were a few issues that had come to the fore which tie in with what I've just said. We recognise that all our experiences will have been different over this time. Some of that has helped or hindered, often dependent on how our hospices and hospitals dealt with and continue to deal with the enforcement of law with regard to patient and staff safety. How we were affected was also dependent on how our employers valued or understood our work as a chaplain, and so accordingly, in some cases, furloughed you, or sent you to work from home, or made you work very difficult and changed it irrevocably. So much so that along the enforced circumstances that you faced, some of you were uncertain as to what your role now was. And maybe you're still not certain of something that perhaps you were. So I hope that what you hear and do over the next few days will help. As I say, we're a smaller number this year. Again, I think it's indicative of a population that is gaining confidence in gathering in this way. I know that some hospitals and hospices only till very recently had said they didn't want people to meet in this way, but this thankfully is changing. Also, I think that this is due to financial issues. But we felt it important that people had an opportunity to meet face to face, to talk face to face, and to experience things together. So the fact that we are smaller than normal, whatever that is, may, I think, be to our benefit. So please care for one another. Find time to speak, to reflect with one another. Speak with Arwin, who I introduced to you earlier. So what have we got for you? Well, I raised the question, who are we now? After all we've experienced, who am I? I run a bereavement group at the hospice where I work, and one of the tasks of the group, I believe, is to help the bereaved over a period of a year gain confidence in who they are who they are without their loved one. And during lockdown, the monthly meetings were on Zoom. Well, certainly for April. Following my misplaced confidence on March the 19th, you remember March the 23rd, so on March the 19th, where I told them that we would continue meeting. How wrong I was. So it was on Zoom for April, May, June, July. But at the end of the July meeting, my heart was so heavy. I had this physical feeling, having watched these poor people in their own homes, trying to deal with all that had happened to them and all that was happening in the world around them, that I just felt we had to somehow meet in the same room. And so we made arrangements for that to happen with social distancing, because I felt that the need was so great. That was a step in the right direction, but what they lacked, certainly for that first year or so, was the opportunity to meet others outside of their circle, to discover who they are, for restoration orientation, if you know the dual process model of grief and loss. I tell you that because we too, in many ways, over this period have suffered loss, both in our personal and home lives and our work and vocational lives. If indeed we now have any boundary remaining between those two, which of course is another issue, do you work from home or live at work? If you're one of those, facing so many people in our communities. So we too need to discover or rediscover who we are, that's what I'm saying, having suffered these losses over this period of time. So after tea, Lawrence McGonnell, who's an exec member and a hospice chaplain and a psychotherapist, is going to kick off with his presentation called Reconnecting with Our Sense of Identity and Mission. And hopefully that will help us to reconnect with who we are and why we do what we do. And following that, before dinner, there's an opportunity, as I said, if this is your first conference, to meet with the exec for that pre-dinner drink. So please come to that. Hopefully another time of recuperation. Tomorrow morning, after Still Point, as we are calling them this year with Arwin, Professor Connor Carville is going to speak to us just briefly. He was here a few years ago and helped us with some creative writing. And he'll speak to us initially, very briefly tomorrow, with a talk entitled Forms of Life and Death. And in doing so, we'll entice you to his workshop later in the day, hopefully, called Writing the Epidemic. So an opportunity to be creative and reflective. I think also he wants to talk about a reading group that he wants to start as well. The keynote speaker tomorrow morning is another professor, Neil Greenberg. He's going to speak to us about moral injury and mental health. What is it and what can be done about it? So he'll be speaking to us on Zoom. Amongst many other things, he has a more than a passing interest in mental health in the workplace. And I believe many of us have either knowingly or unknowingly experienced moral injury over this time. Later in the morning we have our workshops where you can do creative writing with Connor, as I've mentioned, or some further work with Lawrence on identity and mission, or a workshop with Steve Nolan, I'm going to talk about in a sec, on a starting point for research. After lunch tomorrow you have some free time to enjoy the surroundings or sleep or whatever it is you feel you need to do. And then we have refreshments. And after that, we have our third keynote speaker, Podrick Otwama. I'm sure I mispronounce his name every time I say it, but anyway, that's my version for the moment. Podrick is a theologian and a poet. His title is Collect Writing as Pastoral and Poetic Work. And I think, as you would expect, the word collect here is used poetically. Hopefully he'll give us tools to express our thoughts and feelings in poetry. We had hoped he would also lead a workshop, as it indeed says in your programme, but I'm sorry that he cannot do that now. Then following our AGM, which is for all members, Our dinner will have an opportunity to find our regional, after dinner we'll have an opportunity to find our regional groups, or those that are here from them, and have time to reconnect. So if you don't know your regional group, we will do it in such a way as you will meet your regional group. Okay, you will find them, and so hopefully that will work. I know some groups have been supportive of each other over the last 2 years, whilst others have struggled to connect. So this is an opportunity to make acquaintance if you are new, to be welcomed and to reconnect. After that, the bar will be open for further pastoral encounters, and chaplains who are new to palliative care, excuse me, so not new to the conference, this is tomorrow, new to palliative care, or new to this, new to palliative care, there'll be a gathering with some of the exec to talk about your experiences so far. Just want to just hear how you're getting on and any questions you might have. And then later on we'll have a workshop I'll come to. Then on Wednesday morning we have Still Point with Arwen again, and then Karen Murphy, our past president, is going to present a snapshot on her thoughts on chaplaincy, standing our ground and proving our worth, which she recently presented only a week or so ago at the 17th European Network for Healthcare Chaplaincy, which met in Crete. Just mention that. I know I had to go to a representative as well. All right, so it was a tough gig, but we managed, didn't we, Karen? So, following Karen, and very appropriately when it comes to helping us to prove our worth, is Dr. Steve Nolan, who we're very grateful for having with us. Thank you, Steve, for coming. His title is Why We're Already Researchers That Don't Realise It. We need research. Some of you who came to the last two conferences here will remember Prof. Austin Snowden and our attempt to look at the work of chaplains in palliative care using what is called the Scottish Prom. A lot of work went into that project. It had its problems but was finally buried by COVID. So all that work and sadly no result. Research within chaplaincy is difficult enough, but with palliative patients even more so, of course. But we have to find a way. An ambition of the exec this year was to make a presentation about spiritual care at the Hospice UK conference. We are aware of a number of chaplaincy jobs being lost over the last few years, and so in some respects feel that it would be helpful for our CEOs and senior medical and clinical directors of hospices, and indeed Hospice UK themselves, to engage in a dialogue about the importance of spiritual care. Perhaps a reminder of the need to relieve spiritual distress and the essential work of chaplaincy for people of all faiths and beliefs and of none, to play their part in the reduction of a patient's spiritual pain. But the only way you can present at Hospice UK conference is if you are presenting new research that has not been published anywhere else. A few years ago I presented a poster, as I know a good number of you have, or your hospices have, but posters are amongst 300 others, and they really don't get seen. Well, they do, like 2 or 3 or 4 or 10, but it doesn't have an impact in the same way as a presentation to 100 or so might. So yeah, we need that research. So if we are to communicate our worth, we need that research, and I hope that Steve will encourage us with that. I'll also tell you in my report at the AGM of a new national initiative of all the healthcare chaplaincy organisations to work together in research in the UK, which is coming soon. Later on Wednesday morning we'll have our workshop, so an opportunity for you to do a workshop you didn't do on Tuesday, apart from Connor's, and in its place a workshop for new chaplains, picking up on issues raised at the informal gathering, hopefully the night before. And after that, at the end of Wednesday morning, before we have lunch and go our separate ways, we'll gather together to share a time to round up, a time, I hope, where we will be able to share lessons learned, and if you wish, your reflections created, and I hope we will together gain a shared optimism for the future. In finishing, before I ask you to just maybe have a little conversation around your table, I have to tell you this, that in all my years, which is a few now, I've noted them up, of being on the exec, never have I known such pressure on those who volunteer their time to serve on the exec. Some are supported by the hospice, and some have the time from them to do the work. Others primarily do it in their own time. And all that time has been all the more precious this year, and we have struggled. I know I have, but when I see the potential of these next few days, I am encouraged. Our hope as an exec is that you too will be encouraged. I will say that whilst we're talking, that the exec is requiring one new member to come on the exec this year, as well as a Scottish rep, but we're having a conversation about that. But a new member to come on the exec this year. So please do think about it, despite what I've just said. I shot myself in the foot there, didn't I? We're a good bunch, and I think you will have felt pressure in your workplace as well this last year. I think everyone is slightly weary from everything that we've experienced. We're coming out the other side of, as I said, like a breathing really. So please do think about whether it might be something you would do. We'd love to have you on the exec. And please do come and talk to me or another exec member if you want to know more. And once you've gone beyond that, there's a list at the back for you to find a nominator and a proposer and a seconder, and put your name on the sheet, or get someone to put your name on there by the door. And if there's a queue, we'll have an election. And if there's not, you'll probably be voted in, unless anyone knows reason why you shouldn't be, at the AGM. So please do seriously think about that. You've got till tomorrow afternoon. So I hope that what we have to offer over these next few days will be helpful to you and a blessing to you. Thank you for coming. I wondered if you just wanted to, perhaps some of those thoughts I set out with initially, just spend a few minutes on your tables. How are we for time? We're good? Some time on your tables, just thinking about how it was for you over these last 3 years. Some of the most difficult moments and some of the most precious moments. How would that be? And then we'll have sort of some feedback in 10 minutes or so, 15 minutes or so. So just, speak to those around your table, have a conversation. If it wasn't that bad for you, say that. Actually, it was really hard for you, say that. And then just talk about some of the detail of that. So you just start to reflect on some of these things that have happened over this last period. Is that all right?